the medical device is safely put to use in the hospital, its use must also be kept safe for the entire lifespan of the device. Hence, the hospital must make protocols and procedures for cleaning, disinfecting and sterilizing the device so it gets clean between uses, but also for storage, planning and doing periodic maintenance and doing incidental repairs to keep the device fit and safe. In order to ensure that all procedures are executed properly, the hospital must make sure that the users, like clinicians and nurses, know how to use the device and keep their training up to date. The same goes for technicians doing the maintenance and repairs. It must be ensured that internally employed but also externally hired technicians are proficient in their tasks. To make sure that no defects or slow deterioration of devices are missed, the hospital must have procedures for planning and registering maintenance, for getting and using the correct spare parts, and for measuring and validating quality and performance of their devices. Sometimes faults or malfunctions cannot be prevented because it just happened suddenly or due to the device being dropped or maltreated. Therefore, it is important to have procedures for reporting and keeping records of any adverse events, and there must be a plan for what to do when it is discovered that a faulty device has been used on one or more patients before the fault was discovered. And for corrective maintenance, repairs, there should be a procedure to register the malfunction and for releasing the device and putting it back in use after it has been repaired. And even if there were no adverse events, the hospital might sometimes be notified by a manufacturer that there's something wrong with a product, maybe due to a recently discovered production flaw, or because the same device very often malfunctioned in another hospital and the manufacturer decided to take the device off the market for a while to investigate if there's something wrong with the device or if the other hospital did something wrong. There are generally two types of safety communications you could receive from a manufacturer. Field safety corrective actions are actions to correct for safety issues. This might be, for example, that all devices of a certain type, model or batch are asked back by the manufacturer for a checkup, a modification or exchange for a better product, or are retracted entirely, which is known as a recall. Field safety notifications are communications sent by the manufacturer to the users or customers to notify them about a safety issue that occurred and to tell what the user or customer should do themselves and what the manufacturer will do. So a field safety notification could be announcing a field safety corrective action. An example of a simple field safety notification could be that the manufacturer has updated their instruction manual and that users should from now on perform maintenance twice a year instead of the initially mentioned once a year, because a certain part of the device appeared to wear more quickly than expected during the design and testing. So now you know about field safety notifications and corrective actions, but the point that I wanted to make is that the covenant requires that the hospital has a procedure for what to do when such a field safety notification is received. It should be clear who registers the notification, informs the users, and takes any necessary actions. As all good things must come to an end, so do medical devices have to. At some point, the device will not be functional or safe anymore, which is the end of its technical lifespan, or it has become outdated or expensive to keep operational, in which case it is the end of its economic lifespan. Hospitals should have clear procedures for taking a device out of circulation at the end of its lifespan. It should be removed physically from its place of use and labeled clearly as rejected, not approved, or out of service. If the device is still technically okay, it could be used for education or other purposes, but in such a case it must be clearly labeled so that nobody accidentally uses it. Finally, it must be clear how to safely dispose of the device and how patient or user data must first be removed from any electronic device directly when taking it out of service. And of course, how to make sure the medical devices registry of the hospital gets properly updated when a device is removed from the inventory. The covenant mentions quite some more details and procedures than we discussed, but you now know at least the main ones. In other countries than the Netherlands, you can probably find similar covenants or field norms. If you know of them, please share that with us and with your fellow learners in the forum so we can all learn from you. In any case, the points that we discussed should be part of any safe and healthy functioning hospital that values the safety of their patients and their employees.